all we want to do is we want to be there, and we are all on board, all hands on deck, right? What can we do to help save a life or two?
Right. We also have the partnership of two agencies that want to do better for the community, and they want individuals to make changes and want to eliminate barriers. So we're having more resources and more support, and partnership, I think, is everything. And we welcomed that with Community Mission. So, yeah.
Yep. A term I like to use and have used it time and time again with our different programs. It's a community response to a community need, right? That you saw. This community need that came up in community missions, very repetitive with community, but that's what it's all about, right? Is that we were able to respond to a need there. So that's great. So you're watching Community Link. I am joined today by Joshua Anderson and Deanna Bunce from Niagara County Department of Mental Health and Substance Abuse Services here, and they are talking about the Niagara P.A.T.H program, and very excited to do so, specifically our Lantern Project, where we have a safe space for people as they are working their way to and through recovery, let's say, right? Okay. So why is it that you do this work? I can see you're both passionate about it. Why is it? You talked a little bit about your lived experience, and somebody was there for you, right?
It's an absolute privilege for me to be working where I'm working now.
Yeah.
When I turned my life around, I wasn't even 25 yet. And I spent at least 25 years of just doing blue collar work, just trying to fight the good fight, and doing whatever I needed to do to keep my family, afloat. The last 5 years, I got a shot to work in this field, and I realized that honestly, it feels like I haven't worked in 5 years, right? But they say you find a job that you love, you don't work. It is an absolute privilege to do the things I do. I kind of do it on my own anyway. I think when it comes to self-help groups, right, and our philosophy is if I may borrow it from Tim McGraw, when you get where you need to be, turn around and help the next one in line, right? And I think that's just the way to go. So doing this, it's not difficult now. I mean, again, I've been clean for 30 years, right? Or recovery, so to speak. So, yeah.
Mine's less empowering than Joshua's. I think they are a more challenging population in our field. However, I think that's why I like it the best. It's the most, the first time you hear someone say you changed their life, that's the most rewarding part of it. And we don't know the impact we have most days. We don't know the ripple effect we have. I get to work alongside individuals that, have 80 years of recovery between them all. Did I get that, 80?
Between four of us.
Yeah. And getting to learn from them about how to assist people, and getting to, just learn truthfully how to impact a life. And listening to them and learning from them has been an honor. So,
it just happened today. We went to a different class today, and there was an individual. His name was Josh, by the way, and he goes, I'm so grateful that I came across your path, and I didn't know, 5 years ago, he was in treatment, and I was there to help him, and he's been to some of the classes that I do, and he was like, it's because of you and your teaching that I'm still here. I don't know, I couldn't tell you what this guy looked like, but that's the great thing is that they physically change so fast, right? You see some of these people really, really need, an inpatient, right? And this individual, obviously he did because he was at inpatient, but now he's healthy, I think that's one of the greatest things is to see someone that you can't recognize, but they remember you and they remember, what you did to their life, right?
That's great.
It's like fumes in a tank. You know what I mean? It keeps you going.
Yeah, for sure.
Yeah.
For sure. What does, big picture, I'm not going to talk to anybody that knows it better than you two, I'm sure here. Niagara County substance use and abuse, what does it look like? What has it looked like, and what is it evolving to now? Is it better? Is it worse? Is it different?
That's like asking how many clouds have been in the sky yesterday.
Okay,
we only know what we are aware of.
Sure. Yeah.
And this illness happens in the shadows. It happens, closed away. because it's not something, because the stigma that does exist in substance use, which again, why you said trust was so important. So to paint a picture of how substance use looks in Niagara County, we can say overdoses are down, but that's only the documented overdoses. We can't be sure of how many individuals are, possibly overdosing. We're just not aware of it. We do provide harm reduction materials in the community, which I don't think was being done 5 years ago. So we put a big emphasis on public access to harm reduction and placing harm reduction materials so that your Narcan, fentanyl testing strips, maybe condoms, and resources as well, in areas where these individuals may already happen to be. So that's corner stores, barber shops, laundromats. So no longer do you need to go to a pharmacy with a prescription and get your Narcan. So it was eliminating that barrier. So as that's a positive effect, it also, we don't have maybe the full picture of what substance use is going on in our community, but we hope that we have less deaths.
Yeah, this problem has a tendency to convince individuals that they don't have the problem, right? And to deal with that's the thing that's tough, right there. And along with other partners, right? I think that Niagara County has done a really good job in providing, right, materials to help people stay alive, right? And we need to celebrate that. But at the same time, I would challenge everyone to ask themselves, what else can we do, right? The Lantern Project is just simply that. It's a response to that. What else can we do? And we're still thinking, like every day we're spitballing, trying to figure out what our next move is, right?
And one would say too, community missions, the P.A.T.H program encountered community missions because of events that were occurring and we wanted to help. And working alongside with community missions for years, it kind of went from we don't have a problem to we're going to put in a suite in our West Wing and offer all these supports. And they have Narcan on every floor, in every office. They have a vending machine. They have free access to all these materials now. So really the turnaround that community mission and probably your board, I believe, took on is huge. So we are very fortunate that alongside of community mission, we're getting and advocating for these individuals and to decrease stigma.
Right. Well, I'm glad to hear, community missions and to know what we have done ourselves. So for people out there, how can they be a part of the solution? How can they help in some way with this issue?
Right.
That's a loaded question.
I know, I passed it off.
I got 5 minutes or so.
That is a
I passed it
loaded
off.
question. How can we help? How can they help?
How can they help?
I think I think we are so used to asking how can we help that even getting asked it back, we don't know how to respond. We just heard a beautiful quote yesterday actually of a woman saying, she was treading water and drowning, but wasn't ready to reach up and ask for our help to get her out. And you know what, I took that, to heart, and I'm repeating it today as to say, if you do know an individual in your community or your loved one, or yourself maybe, it's having the strength to ask for help or having the strength to support an individual to ask for help, to decrease that maybe judgment that could exist, decreasing that just stop. And if you don't want to be the one to offer the support, linking them to, maybe our phone number that would be a support for them. So I guess passing non-judgment, passing just the message of love and connection, I think that would be how you could help us.
Yeah. I think the thing that active drug use did for me, right, is it brought me to this place in my life. And I would encourage people to try to get here. And where it is asking yourself, is it the drugs or the lifestyle? Is it preventing you from turning into the best version that you want to be? That you want to be, not what someone else wants you to be. That's a personal question. Right? And I think, that kind of introspection is important, right? Do you have the ability to ask yourself and not place judgment on no one else? And do you have the ability to hug the unhuggable, right? And help the people that seemingly don't want to be helped? How about that one, right? That's how we get better, right? I live right in the muck and the mire in Niagara Falls. I live right on 19th Street. Right, and I really don't have any plan to move out. I want to fight the good fight. I've been there basically my whole life. I'm comfortable there, but I do know that it's tough, right? It's tough when it comes to having some of these issues that a lot of our community has. You know, we can all get better, right? Yeah.
So if people are interested, if people want to reach out to you for one reason or another, how can they do that? The office, where's the office located and what's the phone number?
Yeah, so our office is in the Trot Building, which is 10001 11th Street. And we are right down the hall from the DMV. If you've been to the DMV, you know what that line. If you're at the end of the line, you turn around, we are right there. Our sign is right there. And our phone number is, I mean, you can call anytime, right? 716-278-8166. We have someone that's willing to answer that call. And I think that if you don't, you might not even know why you need to call. If you're just feeling like you need to reach out to us, we're going to do whatever we can to try to help you any way we can, right? I mean, we are resource brokers as well. If we can't help you, our job is to try to connect you to who might be able to help you, right?
Awesome. Well, thank you both so much for everything that you do, everything that you have done already, and the lives that have been saved already and to come.
Thank you.
Absolutely. So, so once again, that's the Niagara P.A.T.H team. Very excited about our lantern project. Just cut the ribbon on that a couple of weeks ago. Please go online to communitymissions.org for more information about that project, and also to our social media accounts for more information about the Lantern Project and Niagara P.A.T.H and all that we have going on. A couple of dates to mention once again. On June 11th and 12th, we have our giveaway days there at our main site, 1570 Buffalo Avenue, and also on Monday, July 21st is our golf tournament. We hope that you'll join us there, either as a golfer or a sponsor, or you'd like to donate something for us to auction off. We would sure be appreciative. And if you're interested in donating to us hygiene products we're in need of right now, or your time, if you'd like to volunteer with us, just go to communitymissions.org/volunteer. Thanks so much for joining us, and please join us next time.